Prostate is an important part of the reproductive system of the males, and it plays a vital role in the fertility. It is a pear-shaped organ which is placed at the base of bladder, and the passage of urine passes through the prostate. See, Mauritius ranks 4th among the leading countries in terms of the incidence of this cancer. So it's quite common. There are times when we get relatively younger people coming up with this cancer. The cancer incidence goes higher as we go older, and the maximum number of cases are detected in our practice in this country, and which is also supported by the National Cancer Registry, that the maximum number of cases are being detected between the age of 55 and 75 years. If we look at the statistics of prostate cancer, there is a good part and there is a bad part. The bad part is that the incidence of cancer is increasing with every passing year, and currently it is about 16 per 100,000 of the male population. And the good part is that the proportion of people who die of this cancer is decreasing compared to the increase in the incidence of the cancer. The diagnosis is always based on suspicion, because the early cancers do not really have any symptoms. So to diagnose them early, you have to have a high index of suspicion, and that comes through the health checks, the screening programs, and the referrals from other departments about those where the cancer can be suspected. The most common thing that we do is that we do what is called the levels of PSA in the blood. PSA is something called prostate specific antigen, which is a tumor marker. And if the prostate specific antigen is raised, then we also do a rectal examination to feel the prostate, and sometimes we do get the abnormal feeling. And whenever one of them or both of them are abnormal, we suggest that we should do prostate biopsy. We have to find out whether the cancer is confined within the prostate or whether it has gone out of prostate either locally or distally in the body. So for that we do some kind of imaging like MRI, CT scan, bone scan. Now, if the cancer is confined within the prostate, we call it early cancer, and that is where the cure is very much possible. To treat the organ-confined disease, the best way is surgical removal of the prostate, which we call the radical prostatectomy. Radical prostatectomies these days can be done by 3 ways. We can do an open surgery, we can do laparoscopic surgery, or we can also do a robot-assisted laparoscopic surgery. Surgical removal of prostate is the best way to treat this menace called the prostate cancer. And in the early cancers, if this surgery is done, it really has overcome the cancer. Some reasons, if the patient refuses surgery, then radiotherapy remains the second line of treatment. It is proved beyond doubt that surgery has an edge, a big edge over the radiotherapy. If the cancer is advanced, that means the cancer is no more limited to the prostate, it has gone out all over the body, which we call the advanced metastatic cancer. Then a cure is out of our reach. In that case, the therapy which we offer is called palliative therapy. The palliative therapy is primarily aimed at giving the best possible quality of life to the patient. If the hormone therapy is given and after a certain time the cancer starts progressing again, then we call it castration-resistant cancer of prostate. In that case, we have certain upcoming options in terms of immunotherapy and chemotherapy. A certain group of people between the age of 55 and 70 years should certainly get screened every year for this cancer. And that's the way to catch it early. And to catch it early is the way to the cure. In those specifically where the first degree relatives have had cancers of prostate, their screening should be started 5 years earlier. So let's say starting at 50 years, we should screen them every year till the age of 70 years. That is the way to catch the cancer early and to treat it in a much better way and to bring about the cures.